Minister of Health Dr. Frank Anthony on Wednesday during his daily COVID-19 update. While it is no surprise that there continues to be a daily rise in COVID-19 infections, hospitalizations, and deaths due to the presence of multiple variants circulated in the country, it is believed that the unvaccinated are the ones who will continue to suffer the most. To this end, the minister remains staunch in his call to persons to get vaccinated. Even so, some persons are still hesitant about the vaccine's efficacy, citing that it will not prevent them from contracting COVID-19. While a few fully and partially vaccinated persons have died from COVID-19 complications, the majority of deaths are among the unvaccinated.
Would have been partially vaccinated, and there are very, very few who would have been fully vaccinated. Those who have been fully vaccinated and die are those who would have had a poor prognosis because of several comorbidities. But generally, the majority of persons who have died so far are those who have been unvaccinated.
To date, 345,640 adults, or 73.2% of the adult population, have received the first dose of a COVID-19 vaccine, while 235,081 adults, or 45.8%, received both doses. As it relates to the vaccination campaign for adolescents, 26,683 persons, or 36.6% of the adolescent population, have received a first dose of the Pfizer shot, while 23.3% of the adolescent population received both doses. Meanwhile, the COVID-19 situation may be spiraling out of control in Region 2.
In Region 2, what we find is that in Wakapau, there are a number of cases there, but there are several areas in Region 2 where we have cases. We have currently 157 cases in Region 2, but most of those cases are in Wakapau, 37 of them in Wakapau.
There also continues to be a sharp rise in cases in Regions 3, 4, 6, 7, and 10. On another note, it was reiterated that government's free PCR testing site will not be facilitating tests for persons for travel purposes.
Does the ministry facilitate testing for those persons traveling overseas?
Our policy has been that if you're traveling overseas, then you need to go and get your own PCR or antigen test done. The ministry's resources, the government resources, we are focused on making sure that people who need to be diagnosed with COVID, that we use it for that purpose. So we're not using it for travel purposes.
For the HGP 90 News, Kendell Richmond.